Hi, this is Ekelly. The quality leader I selected is Linda Aiken. Dr. Aiken has been a nurse for over 50 years. She is currently residing in Philadelphia. Dr. Aiken obtained her BSN at University of Florida in 1964 and Master's in Nursing in 1966. She then received her PhD for sociology at the University of Texas, where she specialized in demography. And she also received her postdoctoral research fellowing in medical sociology at the University of Wisconsin in 1974. Currently, Dr. Aiken is the Claire F. Fagan Leadership Professor of Nursing. She's also a professor of sociology and director of Center for Health Outcomes and Policy Research at the University of Pennsylvania. She is a research associate in Penn's Population Study Center, a senior fellow at the Leonard Davis Institute for Health Economics, and directs Behavioral and Social Sciences program of Penn's Center for AIDS Research. Prior to joining the faculty of University of Pennsylvania in 1988, Dr. Aiken was the vice president of Robert Wood Johnson Foundation. While VP, she designed a $100 million demonstration project to improve care for the chronically mentally ill, for which she received an unusual joint secretarial commendation from the Secretary of the U.S. Department of Health and Human Services and the Secretary of the U.S. Department of Housing and Urban Development. Professor Aiken is a member of the IOM, or the Institute of Medicine, of the National Academy of Sciences. She's also a former president of the American Academy of Nursing, a member of American Academy of Arts and Sciences, and the National Academy and Social Insurance, and she's a former member of Physicians Payment Review Commission. Dr. Aiken received multiple awards, but there are two awards that I want to mention in this presentation. Dr. Aiken received the 2001 Baxter Episteme Research Award from the Honor Society of Nursing Sigma Theta Tau International for her groundbreaking research, particularly in the area of nurse shortage issue. This award acknowledges a major breakthrough in nursing knowledge that has been resulted in a significant and recognizable benefit to the public. In addition, she was honored by the American Academy of Nursing with 2001 Media Award and the Friends of National Institute for the work in her staffing issues and patient outcomes. Dr. Aiken believes that there is a safety in numbers and that safe staffing can save lives. She believes that nurses must perform fewer non-nursing tasks and that work must be redesigned in order to accomplish this. Dr. Aiken stated in her interview that in hospitals with administrative support for nurses and where staff resources are adequate, outcomes for both patient and nurse would be better. One of the major accomplishments that major contributions that Dr. Aiken provided is that she's big on research. She completed a large multi-nation study. The study involved a survey of over 43,000 nurses from the U.S., Canada, England, Scotland, and Germany, where they examined the effects of the nurse staffing and work environment issues on patient outcomes and nurse satisfaction. Another major contribution that Dr. Aiken provided is in health policy issues. She is a health policy researcher where one of her research on the workforce and work environment and patient outcomes has had a significant impact on healthcare policy. She is a member of National Policy Commission. She served as an architect of multiple site demonstration testing new ways of organizing and financing healthcare. In her other contribution, Dr. Aiken is a big supporter of magnet approach. She believes that magnet approach remains the most proven strategy to achieve improved patient and nurse outcomes. In addition, Dr. Aiken has also been interested in taking a look at whatever qualifications and education matter in nursing. One of our research found that for every 10% increase in the proportion of nurses with a BSN degree in hospital is associated with 5% decline in patient mortality. Nurse leaders can benefit from Dr. Aiken's work in multiple ways. First, when dealing with staffing issues, nurses who advocate for both patients and nurses could use evidence from Dr. Aiken's research to strengthen their position for adequate nurse and to patient ratio. Also, nurse leaders who support an ongoing continuous improvement would be able to use Dr. Aiken's work to justify reason for supporting nurses' continuing education and professional development. Nurse leaders could use Dr. Aiken's strong belief in building a case for a higher educated nurses. The quality improvement project I'm working on is integration of research and evidence-based education into a diploma nursing curriculum. The purpose is to provide nursing students the opportunity for introduction to research process, critical thinking process, and develop the information literacy skills that will enable them to find evidence that can assist new nurses in clinical decisions and practice. This endeavor can contribute to enhance the quality of nursing practice through education, producing competent nurses, which directly contributes to the improved care and health outcomes of patients. Dr. Aiken's strong position in advocating for both patients and nurses could help in convincing employers to provide adequate resources for nurses to help engage them in research utilization and use of EBP to solve clinical problems. Dr. Aiken's research findings and impact provided an impact to the healthcare policy is a testament that research is important and it works. Also, I would like to instill that to the students that solution to problem that is supported by evidence through research are more likely to be adapted and get buy-ins from everyone involved. Undoubtedly, Dr. Aiken is the most influential researcher in staffing and education, not only in the United States but globally. The impact of her research and her ability to recruit many more researchers into this area of investigation has brought new levels of evidence and science to the topic of staffing and its many implications.